Could you just please discuss the background and the impetus for this study?
Sure. So Oncotype DX prostate's been on the market for several years, and it's been shown to add predictive value for finding higher grade prostate cancer or microscopic spread outside the prostate that might exclude a man otherwise eligible for surveillance and push them toward treatment. And the original studies and the validation studies that were done were mostly done in Caucasians. So the study was designed to look to see how the test performs in an African American population compared with a Caucasian population, in the background of a lot of data that shows that African American men are more likely to get prostate cancer, more likely to die of it, and an ongoing debate about whether or not African American men have biologically more aggressive disease. That latter point is really open to question now. It was believed for a while, but it may not be true. In any event, what the study showed was that the test performed equally well in Caucasians and African Americans in predicting what we call adverse pathology. So that's high-grade prostate cancer or microscopic spread outside the prostate. That was the main gist of the study.
What were some notable findings from the study? It sounds like you touched on them just now a little bit, but what were other findings that might have been notable?
That was the main issue. The spread of scores amongst the populations were the same, and so there just weren't many differences. So what we think that means is that this particular test captures a fundamental biologic process that's associated with more aggressive prostate cancer. And it doesn't matter whether the patients are Caucasian or African Americans. It seems to be equally predictive in finding those things. It seems to be equally predictive in African American men and Caucasians for higher grade cancer that might preclude someone from going on active surveillance.
Do you plan any follow-up research to either, to this study specifically, or just something else with the assay?
Yeah, we're looking at a lot of interesting things right now. So what we've learned in other studies is that the things that predict bad outcomes in men who start on surveillance and end up needing surgery is a certain histologic subtype of prostate cancer called cribriform prostate cancer. And we have some data that's not quite published yet, it's in press now, that shows if your Oncotype score reaches a certain level, around 29 or 30, that's when we start seeing a lot of cribriform histology in biopsies in men on surveillance. And that's an important correlation, because we know if you have cribriform histology, those tumors have molecular features of aggressive prostate cancer. And we think that Oncotype may be assessing or finding that particular kind of biology, and that might be why it's useful. So the field, I think, is morphing to the idea that the higher the Oncotype score, the more attention you should pay and look a little harder for adverse features on biopsy, or depending upon who uses it, you might even just decide to treat the patient, even if the biopsy shows only low-grade disease. And the other interesting thing is that we have some unpublished data showing that your Oncotype score predicts outcomes at 20 years as far as metastatic prostate cancer or death from prostate cancer. And interestingly, that curve starts going up. The inflection point on the curve is around a GPS score of around 30 also. There's one other study that was done at the University of California, San Francisco, by Peter Carroll, that showed men who reached an Oncotype score of 29 or so were more likely to have high-grade disease on a subsequent biopsy. So all of that is kind of falling in place. We think that this is a measure of the fundamental biology of prostate cancer that may be clinically useful in making these kind of decisions.
Okay, great. Is there anything else that you think that practicing urologists should know about either the specific study discussed earlier and also just Oncotype in general?
Well, so I think this test, I think the study affirms the fact that it doesn't matter whether the patient is African American or Caucasian, you can have the same confidence in the test and decision making. That's really the main point.